But I need to bring you the rather distressing news that the junior doctors are now on strike. They've been so since 7 a.m. this morning. For reaction, let's speak to NHS GP Dr. Anita Raja. Good morning, Dr. Raja.
Good morning. Thank you for having me on your show today.
Do you think that this legal action, this strike action will cost lives?
It's a very wrong question that you've put to me. I think what you need to ask yourself is, there is an employer that has thousands of doctors employed, is not paying the doctors. These are not crown servants. These are our workforce that work mostly on goodwill, put in hundreds of extra hours a week.
They don't work on goodwill. No. They work on a substantial salary, which many people graduating from university could only dream of. Starting salary, £39,000, quickly becoming 50K. That's a lot of money.
Why don't you then, do this debate all by yourself? And you need to allow me to speak, sir. This is why you've invited.
Well, you've just told me questions I should be asking myself. I think you'll find this is my show, and I decide what the questions are and who they go to. And it's you.
Sorry, I'm not going to be part of the show then, if this is how you're going to speak, because you've got to keep it very fair. The question is, if you would have a 30% pay cut over the past 15 years, would you be doing this show? No, you wouldn't.
You can't call it a pay cut. It's inflation, which has impacted lots of people, not just junior doctors, taxi drivers, security guards, plenty of my listeners in the private sector who could only dream of these salaries.
Do you know that this is the cream of the society? Doctors are highly skilled workers.
Well, are they better than taxi drivers and security guards?
No disrespect to any of the professions.
The cream.
Doctors put their license at risk every time they see a patient, because they deal with life, human life, which is far more serious. You cannot expect to pay someone 15 to 18 pounds an hour and expect them to stay in the job when there is a better opportunity abroad. We have 1/3 of our workforce that have become doctors don't have a training post, because there are simply not enough training posts. We need to take a step back. If you think people are not dying at the moment, you are incorrect. 500 people are dying just because they cannot access care every single week. If you call out an ambulance, in most instances, there are no ambulances that can come out. If you go in A&E, the waiting times are dire. Our relatives, our parents are sitting in A&E, elderly people, from 12 to 24 hours, because there's simply not enough doctors, nurses out there. We need to create posts. We need to make it very lucrative for them to be able to work in this environment. And I must emphasize that doctors just want this to be fair. And when it comes to doctors, it's not a 9-to-5 job like anywhere else, where you shut your phone at 5 o'clock and walk out. Sometimes we have medical emergencies, and we're sat in that office for far more than that.
And it's exactly like that for many of my viewers and listeners in the private sector, whose income has also been eradicated by inflation. The issue I've got, listen, Dr. Raja, you are a highly respected and very, very popular NHS GP. The work that doctors and nurses do, as well as porters and caterers and everything else, they do an amazing job. My viewers and listeners have no problem with the efforts of junior doctors who work incredibly long hours, and it's absolutely brutal. It was always like that, because being a junior doctor is a tough apprenticeship. But the bottom line, Dr. Raja, is that they've had 29% of a pay rise in 3 years, with salaries that start at £39,000, which is not exactly breadline Britain, moving to 50 to 80,000 within years. And don't forget, it's a job for life.
No, I'll tell you something. Now, I do want to correct these statistics, because back in the day, you call it an apprenticeship. I would disagree with that terminology. It's not an apprenticeship, because these junior doctors now pay for their degrees. So every single doctor that comes through the lines is basically someone who spent 80 to 100,000 pounds on their education.
Still heavily subsidised, and it's a job for life and a gold-plated pension.
No, it's not really.
It's a cushy deal.
The pension is heavily taxed. I think.
Yeah, welcome to Labour.
We've got to take a step back and look at this objectively. What we need to understand is that there is a mass exodus of doctors at the moment. If we look at the numbers from 2022 alone, 1,000 doctors immigrated abroad. If we keep on fighting against our workforce that actually looks after our parents, our family members, out of pure goodwill, it is one of the very few departments where doctors, where they're actually looking after.
Well, if the junior doctors are going to be so greedy, then I'm happy to have a dispensation and get some doctors from Belgium and Spain who are outstanding at what they do and paid proportionally less than junior doctors are in this country. So be it. We can have an allowance of targeted, skilled immigration so that the British Medical Association doesn't hold our country to ransom.
They're not holding your country to ransom.
They're on strike.
This is, I understand that, but what you need to know is on a daily basis, we're already having staff shortages. You need to create training posts. You need to create a better environment for our doctors to stay. They will leave. There's a high demand for them. Doctors are highly skilled workers. If you're going to keep the media,
they're the cream, apparently.
If the media will keep a negative rhetoric and the government will do the same, the doctors will leave. That's all I'm telling you. And, you say that you are happy to take doctors from abroad and you're happy to be treated by... Trust me, that is not the case. There's a lot of racism within the NHS. I think you are very well aware of the reports that are coming out and have come out in the past few days. So really,
the NHS is probably the most diverse organisation in the world.
Out of which 50% are junior doctors, so we need to look after them. If these junior doctors don't stay, then we are in hot waters. That's all I'm saying. We've got to value our workforce. We've got to come on the table. Look, they're spending 240 million every time there's a strike. So far, we've had, 13 strikes altogether?
Yeah, well, this is all an argument against it. It's costing £250 million.
Government needs to prioritise and pump money into the system, not for things that they think are important.
And where's that money going to come from, by the way? Dr. Raja, I can tell you that we're in the red. We live beyond our means. We have a deficit, the cost of which, just for service alone, of the interest is £100 billion a year. So which government department will you take this money out of?
This is the thing. The government will be able to dish out money.
No answer.
They are doing that at the moment. If there is an emergency fund that needs to be created, it's being created. We're spending billions on these strikes now, but we're not happy to come on the table and speak to our doctors.
But which government department should see its budget cut in order to pay the junior doctors?
The exact same budget.
Policing?
That money from
education?
NHS. The thing is, we've got to take an objective view on this. The media needs to be more positive about this. The rhetoric is very hostile from the government.
Too right.
The doctors are not killing patients. The doctors are trying to make the NHS sustainable. If the doctors won't last, the NHS won't last. So we need to hold on to our workforce. These are highly skilled workers. These are people who are going to sustain the NHS. You cannot sustain the NHS on anyone apart from doctors, nurses. Pay them well for heaven's sake.
We've had 13 strikes since March 2023. You are a caring and outstanding NHS GP. You're the kind of figure that makes the service world class. But what's going to happen today is that people will not get their appointments. They won't get their treatment. Some people will be injured. They will suffer injury as a result of lack of treatment. Some will die.
Do you think that this is not happening on a daily basis? If you don't think that this is not happening, this is happening on a daily basis.
Most definitely. And surely more will die with the NHS downing tools, with junior doctors going on strike.
I beg to disagree. I beg to disagree.
What, you don't think more people will die?
Basis. The thing is, if you're going to, this is misinformation that is being spread, which
Here we go. Ticking a lot of boxes. We've had racism, now we've got misinformation. What's next?
The thing is that we have to understand that these guys will
leave. Woke bingo, this.
So you don't need your junior doctors anymore then. You want them to go. You want the NHS, 50% of the workforce to leave. Is that what you like, what you would like?
Yeah, what I would do is I think that you cannot be bullied. When the country is bankrupt, which it is approaching that status right now, there simply isn't the cash. And my viewers and listeners that aren't lucky enough to be in the public sector have seen their wages impacted by inflation. They've also seen recruitment drop. They don't get pay rises. Everyone's struggling at the moment, Dr. Raja. The country is broke. And the big issue now is the impact on patients. Are you telling me that if someone's got cancer and they can't get an appointment today, that's going to be good for their health?
I'm not saying that, and please don't put words into my mouth because that is very dangerous. What I'm telling you is that there's going to be a brain drain. There'll be no doctors who will be treating cancer in the next 5-10 years if we do not speak to the junior doctors. That's all I'm saying. We need to negotiate with our workforce. An unhappy workforce that is burnt out will not be able to give us quality care. These people are the future of the NHS. These are our youngsters. These are doctors that are going to make the future of the NHS. How can we not invest in them? I simply fail to understand what the difficulty here is.
And why, can I ask you why an increase in 29% in 3 years is not enough, given that inflation is just short of 4% at the moment?
Well, it's not 29% in 3 years. They're going to give it very slowly over the next couple of years, which is almost 15 years, if I'm not wrong. And it's not enough because we already have a pay cut of 30% from the previous 15 years. So against inflation, the problem our junior doctors now have is, and I will tell you as it is, they cannot get mortgages. Some of the junior doctors have to, and I'm telling you this because this is what has been circulating. This is the news that has been circulating in the medical circles, that there are some doctors who are having to drive Ubers because that brings them more money, because there's just no extra shifts in the NHS that they can pick up.
How many junior doctors are driving Uber taxis?
Loads now.
Do you have the figures on that?
If you look at what our junior doctors are doing to make ends meet, some of them are trying to bake. Some of them are trying to drive Ubers. They're just not interested.
How is anyone struggling on £39,000 a year minimum?
£9,000 is not enough if you're living in central London and trying to do a proper job. This job is highly stressful. Our job.
How do some of my listeners who make 25, 30 grand a year survive?
These are medical professionals.
Is it because they're not the cream?
These are doctors who are highly skilled workers. They're not comparable to they're comparable to barristers, for instance. What is the starting pay of a barrister? I'm talking about educational levels and comparison of fee according to what you have done your education in. Please tell me, what is the starting pay of a barrister?
Well, it's going to be in the region of £40,000 and it will go up, and it's an excellent job, and it's a job which will pay well. But that's the same with the junior doctors who are already on a good whack. Dr. Raja, before you go, and we're so grateful for your time, by the way, it's a very stimulating conversation. Can I ask you, you support these strikes clearly. Why do the majority of junior doctors not support the strikes, according to a poll published in today's Times?
That is not a correct poll at all. The BMA would not go ahead.
More fake news.
No.
Disinformation.
Most junior
dangerous
doctors.
Talk.
Why? I would say you should answer instead of.
Are you calling it fake news? The newspaper of record of this country, the Times newspaper, 5 days of NHS strikes opposed by most doctors. There it is in black and white.
I'm talking about junior doctors.
Yes, well, surely the doctors are an establishment. They're all colleagues. They object to this because the British Medical Association, Dr. Raja, is a very left-wing political group that are bringing disrepute on the NHS and will have blood on their hands.
I don't think that is, again, the right statements. The problem I have with whatever you're saying is that, you're instilling rage, you're infuriating
Yeah. My viewers and listeners are furious because they can't see a junior doctor today.
Yeah, pay them well, pay them better. They will be there.
Well, listen, Dr. Raja, I know that you're worth every penny because you're a very popular and important NHS GP. Thank you so much for the time. Really enjoyed the remarks that you made. And of course, you'll speak for many of those junior doctors who have down tools because they really want a better package. And Dr. Anita Raja suggests and stresses that we're suffering a brain drain of talent as a result of the poor terms by which junior doctors work. So